Welcome, I'm Dr. Compton, and I actually just wanted to get a selfie. I don't know if everyone has been in a selfie before, but we're gonna get one right here. There's everybody. All right, so now you've been in a selfie. Welcome. All right, so I just wanted to talk about the vertical vector facelift, but before I get into that, I just wanted to say personally, we definitely believe in both the doctors up here. My mom sees Dr. Fai, loves her, and Dr. Collado, my wife knew Dr. Collado, knows him from the hospital, and when she found out I was moving to this building, she was really happy because she was like, I love Dr. Collado, he's so good, he's always taking great care of his patients, and et cetera, et cetera. So we're really happy to be in this building with him. So. All right, so vertical vector facelift. So the big thing with this, we're just gonna get right into it. It's different from the traditional facelift, which is sort of pulling everything back in this way, and it's pulling it more up, which is against gravity, right? So that's how you get that more natural vertical vector, which will restore the volume to where it used to be. It's also how you avoid all this abnormal appearance and the windblown look and that sort of stuff. So that's really the breakthrough that I'm talking about today. So. All right, so where did I learn this? I learned this from this guy, Andrew DeCono. He's actually a world famous facial plastic surgeon who actually more or less developed this technique and refined it. And he is the facelift guy for the stars, basically. And yeah, if you've heard of someone having a facelift in the last few years, that's a big star. He did it. And then Dr. Nyack is also really very famous plastic surgeon. He also instructed me in these techniques as well. He's in St. Louis, excellent guy. I trained with him during my fellowship as well, so I know him reasonably well. So we spent some time in the lab and learned how to do all these techniques. All right, so what is aging? Basically, you change from a upside down pyramid or a triangle, and everything falls, which creates a more heavy lower face. And so as everything comes down, it creates more flattening along the jawline, creates this pyramid shape. And so restoring this shape from this to this is really the goal of this surgery. And most aging face things are attempting to do this with different techniques. So these are some of Dr. DeCono's results that I just wanted to show so you can sort of see what we're talking about. Obviously the neck's very improved, but this whole area has been lifted up that way. You can see it better in some of these dramatic outcomes. I mean, that's just such a huge change in this patient. And these are why I went to study with them and learn how to do these techniques. Another one, I mean, just a massive change in before and afters. And yeah, it's the same person. You can see that the scarring, the acne scarring is the same, but wow, what a difference. So that is basically why I went to see them. So what are we trying to do here, and why are we trying to do it? So the big thing is obviously we have lots of different things that can treat aging, but with this surgical technique, really what we're trying to do is get this right here to elevate up. So we've got the jowl, we've got the cheek fat here, and it's basically sagging down and it's being held up by the ligaments. So we've got facial ligaments here, and that's basically where all the fat and everything's hanging down from and sagging. And it's being caught up at the ligaments. And so we want to release the ligaments so we can reposition the fat. And so you can see that triangle here, and that's the mid-face droop. Now these are the ligaments, this is where they're at, and basically it's anywhere you're gonna see shadowing as we age. And so you've got orbital retaining ligament here, and as this fat drops, it exposes the bone here, and that's why you're seeing that shadowing. Nasolabial fold is because it's attached there, and the fat's coming over it. You got the jowl because you've got a ligament here. So the ligaments are the reason you're seeing a lot of this aging change. And it's dropping right through where there's no ligaments, if you look at. The reason there's no ligaments there is because you want to be able to move your face, you want to be able to talk, you want to be able to smile. So it can't be locked down there, which is why it sags. So there's a few different things you can do. Number one, you can just Photoshop yourself. You know, this is very popular online. You just change your photos, you know? You don't really need to look like that. You just Photoshop it. You could also have a professional makeup artist like my daughter here getting my face done there. She's very happy. She was super happy to do that. Neuromodulators obviously were the sort of the original way to start people into doing more procedural things. So you know, that just softens the muscles, softens your wrinkles. Fillers, you know, refilling the volume in people's faces. So this is another, there's another technique. There's so many fillers on the market, it's really hard to, you know, differentiate between them all. We do have Restylane here today, and they've been very helpful and supportive on our talk, and so we really thank them. So go and talk to them. Peels, oh, I got the wrong one. I guess we want chemical peels. So, I know, it's a dad joke.
I did not
It's a
approve
dad joke. So this would be resurfacing the skin, trying to get better.
There's Morpheus.
And then Morpheus, which we talked about. Oh man, again, bad. So this is really what Morpheus is. Microneedling, getting into the skin, depositing heat, creating collagen. You know, we can go into that. You could spend days talking about how awesome this thing is. But we're really happy to have Morpheus. So, all right, so that's just sort of an overview of what different things you can do. Let's talk about the surgery again. So again, we're just trying to lift that mid-face right there. So this just shows you the cheek fat is sagging. You can see that around the eye is sagging, and then this mass is what holds all the muscles of the face. And that whole thing is sagging as well. So we want to correct all that. And you know, there's a million different surgeries that can correct different aspects of this problem. The thing is that, you know, the smaller the incision you have, the less you're going to be able to affect the mid-face. You're just not going to be able to get out into this area. You can see this short little S-lift, if you will. It just affects this area because it's a short incision. Longer incisions, you can get further out into the face. You really need this long incision to get all the way out there. And that's really the difference in the vertical vector facelift. This is what the incision actually looks like. So, you know, it really doesn't look that big and scary as to what everyone thinks it's going to. This heals beautifully. The hair falls right over it. You can't see it around the ear at all. Really, I mean, you just won't be able to see this incision. So, you know, in brief, what the surgery is make that incision, we lift the skin up, we get into the deeper layers of the face here, lift that, or separate all the ligaments. Remember, that's what we were talking about, the ligaments. So we get under the cheek fat, lift it, and then close it. So, and we're doing a vertical vector of lift. That's the whole name of it. So there's the ligaments. The key is to get out and to separate those so that we can reposition things. One of the really big benefits of this is that we can reposition it without tension. Tension is a killer. That's what limits the length of time that these things last. That's what creates all these abnormal appearances, because you're pulling against tension, or using tension to pull against the ligaments. You release the ligaments, and then you just reposition it gently and softly, create a really nice soft effect. So in practice, this is basically what you see. So you see the cheek fat, it's down, you lift it, and you get it into the right position. Really helps restore that mid-face. In an actual patient, again, you can see fat right here, and then it's lifted and put into the correct position, and all of a sudden she's restored. That's how you get these dramatic outcomes. These are all Dr. Jacono's, by the way. So again, just highlighting exactly the vertical vector. So it does include. All right. So since we have the incision all the way around here and up there, it does include some brow lift, and the reason is because when you move all this tissue up, you get a bunching right here, so you need to lift the brow as well. So you get an extra benefit of a temporal brow lift, which you can see right here just opens the brow up on the outside a little bit. All right, so these are different techniques of facelifts, but basically this is where we suspend from. So the important part of this slide was really, this is where we enter into the deep part of the face, and then we take this and that's where we suspend from, so we're much closer to the actual fat that we're trying to reposition. So we directly reposition it rather than stay back here with a traditional facelift and try to pull it from here without releasing the ligaments. So that's just, you know, highlighting the difference between all the different types of facelifts you've heard, you know, lifestyle lift and the midi lift and all these different things. Those are staying out far, so you're far away from what you're trying to do, which is to reposition the face. So you're just not, it's not going to be as powerful, it's not going to last as long, it's just not going to get done what you want to get done. And then always included for me will be a deep neck lift. So just make a little incision under here, tie those muscles together to get rid of the bands and to create a better angle underneath the jaw. And that's what it looks like. So just, these are my patients. So I did a chin implant and a neck lift here, so you can see sort of what we're affecting there. You may have seen this person around today. She is one of my staff, and we did a neck lift on her. So you can see that we, you know, created this deep cervical mental angle, really, you know, lifted the neck. We also did a face tight on her, and she's getting a lot of stuff. She's really benefiting from so we're doing all kinds of stuff. We're doing IPLs, and you can really ask my staff about anything. They pretty much had it all. They've had Morpheus and IPL and laser hair removal, and so it's great. So they can answer all your questions. This is another one of my patients who I actually did a facelift on, but I wasn't doing the vertical vector at that time, so the mid-face hasn't changed. But you can really see that, you know, I got a good jawline going here, next improved. We did get some improvement through here, but, you know, again, didn't do the mid-face lift because I didn't know these techniques at that time. All right, so yeah, it's really enough of that. So let's just talk about it. So through the end of the year, this is on super sale. It's half off, so I'm just trying to get, you know, launch this thing and really get people excited about it and get some before and afters. That's really what we need. So, and then also on sale just tonight is a lip lift. So you can see that we make an incision around the base of the nose and lift the lip. You can really see improvement in the volume of the lip, the exposure of the red lip. Pretty significant change. Buccal fat removal also tonight only. So improvement in this area. So we remove fat through the mouth, and it really thins this out. She's only a couple weeks out, but you can really see that there's a better definition in this cheek already because the fat under here has been removed. And then blepharoplasty. So again, upper eyelid lift. So again, these ones are only on sale tonight, and then they'll be back at regular price tomorrow. The facelift is on sale through the end of the year. So, all right. Does anyone have questions? Thank you for coming, everyone. By the way. Yes.